Our next speaker is Anne-Marie Holt. Ms. Holt is a practicing epidemiologist. She is the manager of epidemiology and evaluation services at the Halliburton Kawartha Pine Ridge District Health Unit and is president of the Association of Public Health Epidemiologists of Ontario. Anne-Marie?
Well, it's a pleasure to be invited here this morning, and I just like to thank all of my other speakers here as well. Ever since the federal government announced this situation early this summer, a variety of groups have spoken out about the discontinuation of the long form, and the Association of Public Health Epidemiologists of Ontario is one of those groups. The Association of Public Health Epidemiologists in Ontario, also known as a FEO, has 250 members that are public health epidemiologists, data analysts, and health researchers that use the information on the census long form on a daily basis. Our members use this information to understand and plan for the health needs of residents and to inform decisions around services such as screening, education, and public health interventions that are provided by public health units and other organizations across this province. As you've heard from the previous speakers, the data provided by the long form is invaluable in its use. It enables everything from population-based research to identifying trends and changes in the population in order to provide health services. When it comes to responding to a public health emergency, however, the information contained on the mandatory long form is critical. There's generally 6 types of public health emergencies: chemical emergencies, radiation emergencies, natural disasters, bioterrorism, as well as disease outbreaks, as we saw with the H1N1 pandemic in 2009. Whatever the emergency is, public health units and healthcare providers are called into action to respond to the situation and work to protect and preserve the residents of Canada and Ontario. To do this, these organizations and epidemiologists within these organizations must plan for what has not yet occurred. And to do this planning, we use the census long form. This planning could be used to identify populations that may be more vulnerable or susceptible to risk of hunger, disease, in the case of an emergency. Vulnerability may be due to income, education level, family situation, all information that's provided by the mandatory long form. Without this census information, we will not be able to provide these people with the extra support that they may require during a public health emergency. Often, for emergencies, we need to identify first language or language spoken within the home in particular areas, so that understandable information and appropriate resources can be made available to those on how to deal with an emergency. Information, again, provided by the long form. The data enables epidemiologists, along with other public health professionals, to identify areas in our communities that are at greatest risk. When we look at the impact of the information collected and the questions contained on the long form, we can see its impact on the health of all Canadians. And it's easy to see why a FEO, together with so many others, believe that scrapping the long form is a mistake. The census long form is the gold standard for important information regarding all Canadians. In our opinion, replacing the mandatory long form with a voluntary survey would be a step backwards, as many people we know would choose not to complete the survey, and we know that those at greatest risk, has been indicated earlier by the other speakers, are those that are in most need of programs and services. And those are the individuals that tend not to complete voluntary surveys of this kind. The health of an individual depends on the health of a population, and the better the data, the better the ability for public health units and healthcare providers to plan for the protection and preservation of our health. Thank you.